Statement of fact number 18. The patients were primarily seen on a day-by-day basis by Dr. Buttar's nurse practitioner, Jane Garcia. Ms. Garcia, for instance, was the provider who saw patient A on her initial visit, and it was Ms. Garcia who wrote the note in patient's A chart to start patient A on the cancer plan. I have only so many hours in a day. I only sleep 2 to 4 hours every night, and those of you that know me know that to be true, and that's been my schedule for years and years. At a certain point in our practice, we had a 2-year waiting period, a 23-month-long waiting period. And it was absolutely appalling that people had to wait that long to see us for treatment. And so I had to make a decision. I couldn't see everybody. I brought in my nurse practitioner who applied, and I chose her over 17 other doctors that applied for the position, because I found her to be more anal retentive and more adamant about making sure that all the I's were dotted and T's were crossed. And she came on board to help me. Every single chart in my office is reviewed by myself and Jane on a weekly basis. If we have a patient that was seen that month, that particular week, we see that chart that goes across my desk and we discuss it. And it may only take me 10 or 15 seconds to review the chart and make sure everything was done right, but that doesn't mean that I have an hour to spend with the patient. So Jane has been seeing many of the patients that I did not feel needed my intervention. My intervention is always there for every patient, especially the more critical patients, but we had to reduce our time to see patients, because it's not fair for patients to have to wait 1.5 years, 2 years to come see us. That was the reason that would happen. And many doctors have physician extenders. They have PAs and nurse practitioners. The only difference in my clinic is that every chart goes across my desk. Every chart has to be reviewed, and every chart we have a notation system to ensure that I concur with the plan that Jane has. Jane's experience with me now over 5 years. She knows what I think. She knows how I think. She knows why I think what I do. She understands all that, and she has put aside her own ego, and she has looked at everything the way I would look at it. That's one reason I trust her, because she will ask me 9 out of the 10 questions she asks me, she already knows the answer to. And I have told her, Jane, you already know this. Why do you ask me? And her answer is always the same. I just want to make sure. But she is impeccable, and she follows my protocols better sometimes than I do. So my whole point is that if somebody else is seeing a patient, they are, 1, licensed to see the patient, and 2, they have been seeing, the patient is being seen underneath still my authority and my oversight, and that is done on a regular basis. Once a month, all charts are reviewed of the patients that were seen that particular month, and we try to do that on a weekly basis. Regardless, I don't have to justify that, because I have a nurse practitioner who is licensed to see patients. No other doctor tries to justify why their nurse practitioner or their PA sees a patient rather than them. So I'm not sure why the medical board has an issue with my nurse practitioner having seen a patient. Every one of these patients has been documented, how many times I saw the patients, and it's all in the chart, so you can see how many times my signature's there, how many times I saw the patient, how many times I did procedures on the patient, how many times I consulted with the patient, and how many times I consulted with the patient's families.